Hi, everyone. Good afternoon. This is County Executive Pat Ryan. Thanks for joining me on this Thursday afternoon. I'm going to dive right in. We've got a lot to cover today. In particular, a very significant update about our vaccination process, which will go into effect starting next week. And I think some additional detail and clarity on that process that I've heard from many of you you're wanting and needing, and so hopefully we'll help address those concerns. So we'll talk about that shortly here. Before I do so, I'll talk, as always, about the state of COVID in the county in terms of the infection rates and so on. Right now at the top level, the numbers continue to improve, and we continue to feel that we're on the beginning of, but definitely the downslope at the end on the backside of our second wave. So that is relative good news, but we have more work to do to get those numbers down and also to avoid any potential additional spread, especially given now the introduction of the UK variant into the county and into the larger state and country. Starting with the numbers, we are currently at 10,125 total cases. Unfortunately, between our last update and today, we did cross that threshold of now having over 10,000 total cases in the county since the beginning of the pandemic. We've administered just shy of 260,000 tests, had 7,584 recover, thankfully, and unfortunately, an additional 2 fatalities in the last 2 days since my previous update, bringing us to the grim number of 222 neighbors, friends, family members, coworkers lost here in Ulster County. And hopefully those numbers start to get down and stop very quickly here. And of course, as always, my and our sympathies from everyone in the community to those that have lost loved ones to this horrific virus that continues. Looking at the hospitalization numbers, encouraging news here. We continue to see a decline. We are now at 13 hospitalized currently in Ulster County, 0 in the ICU once again, so that is particularly good news. And you can see on the graph now a clear downward trend in hospitalizations, which we hope and will continue to work to continue to see that downward trend. In terms of active cases right now in the county, we're holding steady in this regard and expect to see this number to continue to decline. We're at 2,319 active, but we are each day working our way through and processing all those that are recovering. So we expect to see those numbers continue to go down based on the current trends we're seeing of new infection rate and lowered hospitalizations and so on. So that is good news. In terms of the new positive rate, we are also seeing this continue to come down, although not as low as we need to get it. In the last 48 hours, our new positive infection rate is 4.72%. So in the last 48 hours, a 4.72% new infection rate. The numbers behind that, we tested 2,942 in the last 2 days and had 139 new positive cases. And once again, the graph is very clear here where you can finally see we're starting to get the number of new positive cases each day is much lower than it was at the end of December and into January. So that is good news, and we expect the hospitalizations and active cases to correspondingly decrease. All of that will only hold true, though, if we continue to do our part, each of us individually and collectively, in terms of taking the virus seriously, maintaining all those precautions, in particular wearing masks and following the new and improved CDC guidance in terms of ensuring a proper fit of mask, which makes a big difference based on the new research that I'm sure many of you have seen. We'll talk more about that in the coming days as well. Looking at longer-term projections, this is our look-forward graph, and again, we are finally starting to see the second wave flatten a little bit. This is the cumulative projected cases, and working hard to follow that green best-case trajectory and make sure that we slow the spread here and ultimately control the spread. Hospital capacity looking forward, we're in very good shape here. These are some of the lowest hospitalization numbers we've had in many months. Once again, we're at 13 currently hospitalized, and more than adequate capacity going forward. And particularly just on a very human level, very good news to know that right now there are no folks hospitalized in an ICU bed and having to be on a ventilator, which I just can't imagine how difficult that is for them and their loved ones. So that is good news. How do we keep it that way? Two ways. One, of course, is ramping up our vaccination, which we'll talk about here in a minute. But in the interim, the most impactful tool that each of us have to control COVID and keep ourselves healthy until we get more vaccine supply is just to continue to follow those precautions, continue to wear masks, continue to social distance, continue to wash hands, and avoid those gatherings and indoor gatherings, which we now know are the predominant way that we are transmitting COVID, often to friends and loved ones who I understand we desperately want to see, but who we are then putting at risk and putting really the whole community at risk. As just a reminder of this, and you know, I hate to be so grave, but the month of January 2021 was by far our most deadly month for COVID, and that is a direct result, we believe, of a series of holiday-related gatherings, even going all the way back to Halloween, building in Thanksgiving, and building in Christmas, New Year's, and Hanukkah, and other winter holidays. All that compounded to unfortunately lead to just very significant loss of life, and so we cannot allow that to continue and happen again. So please continue to do the work you're doing on that front, and thank you to everybody that's doing so. Switching gears now and talking about vaccines, I'm going to briefly just talk about where we're at this week, and then we'll mostly talk about where we're going next week and how we're going to approach that. So this week, as a reminder, as I said on Tuesday, Ulster County this week was allocated 1,500 total vaccine doses. Unfortunately, that was actually less than we received the week prior. That was primarily due to less doses coming from New York State and going to our healthcare workers. The good part of that is that means that most of our healthcare workers have been vaccinated, but to see those numbers decline week to week is obviously the opposite direction of what we want, and we're pushing very hard with the state, and they're pushing with the federal government to make sure that we get the supply ramped up, and we are at least tentatively anticipating more supply and potentially significantly more next week. So that is hopeful news. We won't know that for a few more days what our allocation is, but that's what we've been told to possibly expect. Of the 1,500 doses we've been allocated this week in Ulster County, here's the breakdown by current phases. Once again, 1A are our healthcare workers, 100 doses being administered by hospitals and our healthcare practices. 1B are our essential and frontline workers, 500 doses which are currently being administered by our Ulster County point-of dispensing sites in Ellenville and Kingston. And then finally, our seniors allocated 900 doses primarily through the private pharmacies, which I'll list here in a moment. And in addition, as I mentioned Tuesday, there will be a New York State-run pop-up vaccination clinic in Kingston on Friday morning, tomorrow. And unfortunately, that has already been pre-booked and filled by the various community groups that are participating, including People's Place, the Second Iglesia Church, the Center for Cooperative Education, and other Midtown Rising and other community groups that are making sure that as we go about our vaccination distribution, that we're really proactively getting the limited supply we do have to our underserved populations represented by those different great community groups. So that'll be happening tomorrow in Kingston as well. These are the private pharmacies, currently 7 locations in Ulster County. I want to be very clear about this. The state has directed and decided that, at least at this time, for seniors 65 plus, Those doses do not come to us, at least this week, do not come to Ulster County. The state has decided to directly give those to the private pharmacies. So each of these 7 pharmacies are each getting 100 doses this week, which we know is just not nearly enough. I've been very clear with the state consistently that I disagree with that approach, and I think that adding directing these to all of these private pharmacies makes it much more difficult in an already difficult process for our seniors to navigate. So I will continue to push on that front, and we have a little bit more news about that starting next week. But I know, hearing from many, that has added an additional layer of complexity, and I hear that, and we're doing everything we can to address that. But in the meantime, those seniors, at least for this week, have to go directly to those pharmacies. All that being said, and this is the bulk of what I want to focus on today, I think it's very clear from talking to many of you, from I'm sure the comments coming right now on Facebook, from the messages we're receiving, the phone calls, the emails, even just a letter that I got in the office this morning as I came in, that the current approach has caused great anxiety and concern and confusion for tens of thousands of people in the county who are theoretically eligible, but who don't really understand where they fit in that process and when they might expect to be vaccinated, or even really the best way to go about getting it. So, I on a personal level, it's just been absolutely heartbreaking and just really tough to talk to so many of you and hear from my colleagues that are talking to you that are beyond frustrated. And I think it's very clear that we do need a new approach. So today I'm going to talk about a new approach that we're going to take here starting next week in Ulster County. It's not going to solve all of our problems to set reasonable expectations, but there are 2 main pieces to this that I'll talk through that I think will significantly alleviate much of the concern and pressure and confusion that many are experiencing, or at least that's what we hope. Much of this is made possible by the fact that starting next week on Monday, New York State is now allowing those of any age with 16 different underlying health conditions to now be eligible. So that gives us more leeway to create a new approach, but it also gives us a lot more people that are eligible. So let me dive in with a few slides here, and please bear with me. I'm going to do my best to explain this process. We will also be putting this out in a detailed press release. We'll be posting it on our website and doing everything that we can to communicate this clearly and consistently. But please help spread the word about our new approach here in Ulster County on vaccine distribution. So 2 main pieces to this new approach. Number 1, and we've heard this consistently from so many, folks want a clear and simple place to do to sign up on what I would call it is a pre-registration list. A list where you can go and sign up and know that you've taken that first step and said, I want the vaccine, and when I'm eligible, please let me know. So we have been doing that through our COVID-19 page. But we're going to build on that effort and make clear and explicit to everyone that this is a pre-registration list, which many of you have been asking for. And I'll talk about how that's going to work in a second. The other piece to this, though, is in addition to having a clear list where people can essentially sign up to get in line, we also want to make sure people understand within that line, where do you fit? So where in that line, based on priority, are you, and when can you reasonably expect to be vaccinated? So that at least folks have some sense that if I sign up, I know I've signed up, I know I have a place, and I generally know, if not an exact date, of course, I know roughly where I fit in the relative order of things. So our new approach, once again, has those 2 aspects, a pre-registration list and a set of 4 high-risk priority groups. So everyone in the county will fit into one of these 4 groups, and that'll give you a sense of, in a relative scale, where you fit. Once again, the 2 goals we're trying to achieve with this new approach. Number 1, make a clear create a clear line, if you will, and a line that's based on health risk. So those priority groups are based on making sure that the most vulnerable and high-risk people are earlier in the line, given the limited supply. And then the second goal is to help each of you and every resident understand where they generally fit in that line, so that at least we have some sense of predictability and equity and fairness in how we're doing the process. I want to talk a little bit about the methodology that we're using to build this list of priority. It's all based on medical research and science and the evidence that we now have from the CDC and from the New York State Health Department and from our own health department of who is at greatest risk to COVID, and once again making sure that they are given priority to go ahead of others as long as we continue to have limited supply. So the first factor that we've looked at is age, and we know from all the data and research, and I'm going to put up a graph here, these are the New York State fatalities cumulatively, 36,000 plus by age group. And the high-level takeaway here is that 88% of the fatalities in New York State have tragically been among those that are 60 years of age or older, and 60% of the fatalities have been people that are 75 years of age and older. And the CDC has specifically put out guidance that folks 75 plus in particular are at very high risk from an age perspective. The other factor that we've looked at and that the data has painted a very clear picture is a set of underlying health conditions, also known as comorbidities, where folks that have these underlying health conditions who do get COVID are at a much greater risk of getting very sick or possibly succumbing to the virus. So in New York State, we'll put up this stat now, of the 36,700 of our fellow New Yorkers who have passed from COVID, 91.6%, 33,000 plus, of those that have passed had at least one underlying health condition or comorbidity. So when you combine those two factors of age and underlying health conditions, those are two of the really the most important and significant factors that lead to greater risk among those who might be exposed or who do get COVID. So I'll talk about in a minute how we built that into our system, but I wanted folks to really understand that a great deal of research and thought by all of the health experts help us understand how to build this priority list. The other thing that I want to talk about is just, and I know I'm sharing a lot of numbers, but I think it's important for people to have really all the information and the data to really understand the bigger picture of what's happening. I want to talk about the numbers of people that are eligible compared to the number of doses that are available. So I'm going to put up another slide here and talk through these different numbers, and please bear with me, but I think they'll make sense, hopefully, to everyone as I talk through it. So Ulster County, total population of Ulster County is right around 180,000 residents. Of the 180,000 residents, about 150,000 of them are over the age of 16, meaning that they are old enough to be theoretically eligible to receive the COVID-19 vaccine, Pfizer, Moderna, or any of the other variants as they are approved. So there's in total 150,000 people that from a starting point could be eligible. Up through this week in New York State, with a Category 1A and 1B and seniors as determined by the state, right now 70,000 residents of that 150 are currently eligible to go and get the vaccine. Starting next week, based on the state's guidance to add those with those underlying health conditions, that's another 50,000 people that are now eligible in Ulster County. So all told, effective on Monday, February 15th, there will be 120,000 people that are theoretically eligible in Ulster County. Now that's good news because it means that there's a wide set of people that now could get the vaccine if, and this is the big if we had adequate supply to do so. The problem is, while we have 120,000 people eligible, we have only received about 12,000 total doses in Ulster County cumulatively since the beginning of the vaccination process. So around or even less than 10% of the supply to meet the necessary demand. So that creates a huge problem where we now have tens of thousands of people who are eligible on paper and of course are very anxious to get the vaccine, but because of the limited supply and all the other factors that have gone into the system, are left feeling kind of left out or frustrated or unable to get that. And I understand that that's a really not a good place for folks to be right now. And so what we're going to do based on that is we've laid out 4 different categories, as I said, to take those 120,000 people and at least have some sense of a line, of a sort of priority groups within that large population of people that are eligible. So I'm going to put up a busy chart here, and again, I'm going to talk you through it. And believe me, we'll be talking about this many times, so I understand this is a lot of information to process the first time, but we'll continue to talk anybody with questions through this and share it on our website and so on and so forth. So once again, what we did here is we looked at those data-driven factors. We looked at age, we looked at underlying health conditions, and we looked at whether folks are an essential worker and therefore exposed to COVID required to be exposed to COVID to maintain their job and to provide for their family. And based on those 3 factors, we created these different priority groups based on risk. So I'm going to talk through these, and ultimately what this will let us do is put everybody in one of these categories and give you a better sense of where you fit in the order, and as we get more supply, make sure that as we're distributing vaccines that there is an orderly process to this and that everybody knows sort of where their place is. So the first group of the highest risk is the red risk group. There are 2 categories of people eligible in that group. The first are those that are 75 or older with one of the underlying qualifying health conditions, and I'll put that list up after this. So 75 plus with a health condition or an essential worker with an underlying health condition. So that is the red group of the highest risk. If you're in that group, you'll be the first among the larger pool to be prioritized, again, based on that risk. And assuming the current supply that we have, which we hope increases, but to be safe and to be cautious, at the current rate of supply, it will take us through the month of April just to get through that first group, that red group of 75 plus with health conditions and essential workers with health conditions. So that's the red group. The second group is risk group orange. Those are folks 65 to 75 with underlying health conditions and essential workers without underlying health conditions, but who still are at great risk because they have to continue to work. At the current supply level, it will take us into the month of June to vaccinate through that group once again. We hope and frankly expect the supply to increase, but we want to set reasonable expectations of, in the worst case scenario, how long that might take. The third group is the yellow group. Those are adults of any age with those underlying health conditions and those that are 65 plus without one of those health conditions. And again, at the current rate, that would take us through October, which is pretty tough to think about. But again, I want to set transparent expectations that at the current supply level, that's how long it would take us. And the final and fourth category is the green category. Essentially, this is every other group or every other individual which so far have not been made eligible by New York State. So this would be folks under 65 who don't have those underlying conditions and who are not essential workers. And at this point, without more clarity from New York State, I don't want to put a date on, how long that would take, but that would be that last group in the relative priority groups. Again, I just want to make clear the caveat that those projected dates are based on the current supply. So that's one important caveat, and we hope that goes up, which would speed up the timeline. The other important caveat is these are just the vaccine doses that New York State is providing to us, to our Ulster County Health Department. And remember, New York State is also providing doses directly to the private pharmacies and will continue to do that in parallel to this. And that will allow those that are anybody 65 plus to also have that option to go to one of the private pharmacies if for some reason you're further along in the line through the county. So for those 65 plus, you'll have both of those options. And I wanted to make that clear as well. Finally, for the healthcare workers, which is category 1A, that's essentially being handled directly by hospitals and healthcare providers, so I did not talk about that group here. And frankly, in Ulster County, we are thankfully almost through that group of those frontline healthcare workers that are at the greatest risk in that 1A group. I know that's a lot of information. I'm going to put up another slide with a bunch of words on it. This is the exhaustive list provided by New York State of those 16 underlying health conditions which would qualify you to be higher up in the priority. This is quite an expansive list, but again, these are all based on the state health department, the CDC's recommendations, and research about which underlying conditions put people at significantly greater risk for serious illness or death due to COVID. So I'll leave this up for a second. Again, this will be available on our website and also shared to anybody that's already signed up on our Ulster County list. But I'll leave this up for just a moment for people to read through. As you're reading through it, and again, because it is an expansive list, remember this group alone is about 50,000 additional people in Ulster County who are now eligible with these underlying health conditions, in addition to the 70,000 that were already eligible. So I've talked through this new approach. I've talked through kind of the data-driven approach behind it and laid out these categories. And I'm sure the number one question from folks is, okay, so what do I do now to make sure that I'm able to sign up and pre-register if I haven't already, or to confirm that I'm pre-registered, and really to find out which of these groups and confirm which of these groups, priority groups, I belong in. So that is a relatively simple thing to do, thankfully. The thing that you just need to do is sign up on our Ulster County vaccination page, which we've had up for the last month. This is our pre-registration list. Currently, we have just over 30,000 residents that have already signed up on this list. So if you've already signed up on this list, you've taken that first step. In the next few days, you will receive, if you've already signed up, you'll receive another message from us letting you know, confirming that you're on the pre-registration list and telling you which of these groups you are in, red, orange, yellow, green, and so on. And that way you'll know where in the relative line you belong. And then as your group comes up, you will get the opportunity, as appointments open up, to actually sign up via email or via phone as your group becomes eligible. One of the questions that I would anticipate from folks is, okay, say I'm in the red group of the highest risk. And there are several thousand people that are already pre-registered in that group. How are we going to decide among those folks? So we will continue to use the medical research and primarily use age. So, for example, an individual who's 95 would be prioritized ahead of those that are 75 within that relative group. Again, none of this is perfect, but we're really using the best available data and health research to guide these very difficult decisions. So once again, if you've signed up and you're one of those 30,000 people, if you've received emails from myself or a health department, you're on that list and you will get another one of those here in the next few days confirming that. If you have not signed up, and there are many who have not, because again, only 30,000 have, please do that. Please go to vaccinateulster.com. That's vaccinateulster.com. That will allow you to sign up on our pre-registration list. You'll then get a confirmation that you're signed up, and you'll be told which of those priority groups you are in. And eventually, when your time comes, you'll be able to sign up for a specific appointment. That is the easiest way to do it. If you have internet access and you're able to go to the website, or you have a loved one or a friend who can help you, that will be the fastest and easiest way. I know that that's not an option for everyone. So if you are not able to sign up online, what you can do, there are two different ways, places to call so that you can talk to someone. The first is our Recovery Service Center. That number is 845-443-8888, 443-8888. I'll be transparent and set expectations. Again, we anticipate that we'll get quite a lot of calls in the coming days. So please be patient if you are calling. We will get to everybody, but there are many folks who we expect will call. So again, that's why, if possible, I would encourage you to use the website to sign up. It'll definitely be faster and hopefully easier. The other number that you can call if you're not able to sign up online, and if you're not able to call the Recovery Service Center, if you are a senior, you can call our Office for the Aging. That number specifically is 845-340-3456, 340-3456. And I apologize, I don't have that on a slide today, but that is our Ulster County Office for the Aging, 340-3456. Once again, if you've heard all this and you want to sign up, vaccinateulster.com or call one of those numbers. That will put you on our pre-registration list. That may mean that you'll have some time to wait, but at least you will now have some sense of relatively how long it will take. And you can feel somewhat more reassured that you have a place in the line, and that as the line hopefully speeds up, you'll be able to hold that place. I think this is an important step that we're taking. I want to thank our team that's been part of building this. If we need to adjust as we go and we're having issues, don't hesitate to let us know. But I think we've built a good approach here, and this will help alleviate some of that pressure and stress. This is not a perfect analogy, so bear with me. But the way I think about this is, I know many of us haven't flown in a while, but this is essentially the rough equivalent of boarding groups getting onto a flight where you may not know exactly your boarding order by specific spot, but you know which group you're in, and you know that if you're in that group, you're going to get on with that group ahead of those other groups. There's nothing exactly quite like what we're doing here with this vaccination process, but that's the closest analogy, at least in my mind, to help understand what we're doing here. All of this is undergirded and kind of driven by the predominant challenge that we face, which is that we still desperately need more vaccine. Once again, we're starting Monday going to have 120,000 people eligible and just about 12,000 doses, so about 10% that we've received. And until we can pick up that pace of vaccine supply coming from the state and federal government, we will continue to have longer waits than we would like. Again, we're going to do everything we can to be as clear and transparent and equitable within those constraints. but I do want to be straightforward about that as well. I am continually, believe me, on the phone and email and every other form of communication, advocating and pushing to get us more, as I know every leader in every place is, because this is a statewide problem and a national problem, and hopefully it will be addressed soon. That is the bulk of the update today in terms of COVID vaccination process. We will go over this again in my next update, and once again, all this information will be available on our Ulster County COVID-19 webpage. The other thing, as I wrap up, that I just wanted to share with you all, which I've mentioned the last few times, if you are able and interested, would love for you to tune in next Tuesday, February 16th. I'll be delivering my virtual 2021 State of the County at 3 p.m. on Tuesday, February 16th. That'll be broadcast live right here on Facebook, and we'll also be posting it if you want to watch it later. If you're having trouble going to sleep and you want something to put you to sleep, you can put on my State of the County. Sorry, that's my bad joke for the day. But in all seriousness, please do join if you're able. It'll be about 15 minutes, and I think it's obviously a really, really pivotal moment for our county, and a time where we not only need to focus on getting through COVID and getting vaccines out safely, quickly, equitably, but where we have to have a forward-looking, constructive, optimistic vision to come out of this better, stronger, and more equitable. So that's what I'm excited to lay out in that speech next week. Finally, wrapping up, thank you to all of our essential workers. I know there are many efforts underway this weekend with Valentine's Day on Sunday to get Valentines out to our frontline and essential workers. I'll be sending some. I know Congressman Delgado is going to send some to our workers at our vaccination clinic, so thank you to him. And I know many others are doing this. If you have a chance, I know it's not the typical Valentine's Day, but think of Valentine's Day as an opportunity to thank one or more of the frontline workers in your life, in your world, whether that's a family member, a friend, or just the person who's putting themselves at great risk to make sure you get food and mail and packages and news that you need and education and all the other critical, essential things that we need. So thank you to all of you, as always. Thank you to each of you for tuning in. Thank you for your patience and understanding. I know this is a particularly tough time with the vaccination process. You may or may not be able to tell by the bags under my eyes, but I am literally losing sleep, trying to do everything we can to get this right, and we will continue to do that and do everything that we possibly can. Please continue to reach out. Let us know what you need, and we are here for you and doing everything we can. Thanks to the Radio Kingston team. Thank you, Diane and Manuel. Once again, here is the RSC information, and I will see you at our next update, Tuesday, 3 p.m. In the meantime, be safe and healthy and resilient, and have a good weekend.